Wendell Potter joins us now. Welcome to the Journal.
Thank you very much for having me here.
You worked for Cigna 15 years and left last year.
I did.
Were you pushed out?
I was not. I left. It was my decision to leave, and my decision to leave when I did.
Were you passed over for a promotion?
Absolutely not, no.
Had you been well paid and rewarded by the company?
Very well paid, and I, over the years, had many job opportunities, many bonuses, salary increases, so no, I was not. And in fact, there was no further place for me to go in the company. I was head of corporate communications, and that was the ultimate PR job.
Did you like your boss and the people you work with?
I did, and still do, and still respect them.
And they gave you a terrific party when you left?
They sure did, yeah.
So then why Congress that the industry has hijacked our healthcare system and turned it into a giant ATM for Wall Street? You said, I saw how they confuse their customers and dump the sick. Also, they can satisfy their Wall Street investors. You wrote a column just the other day with the headline, Obama's False Friends of Health Reform. You use as a prime example a man named Ron Williams, who is at the top of the list of insurance executives in terms of their compensation. We actually saw Ron Williams at President Obama's town hall meeting.
I would commend the President for the commitment he's made to really try to get and keep everyone covered. And I think as a health insurance company, we're committed to that.
Who is Ron Williams, and why do you use him as the example of what Wall Street expects and wants from the insurance company?
He has apparently had a seat at the table of healthcare discussion. He was recruited by Aetna from WellPoint. Aetna had gone on a buying binge. There's been an enormous amount of consolidation in the health insurance industry over the last several years. Aetna bought a lot of competitors, and it reached 21 million members. And but what it realized and what investors began to see is that a lot of the businesses that it had bought were not all that profitable. So Aetna was in a pickle, and they saw their stock price starting to plummet. So they brought, among the things they did was bring Ron Williams in, and Williams, among the first thing he did was order a revamp of the IT system, so that
the information technology
exactly, so that the company could determine more about which accounts were not profitable or marginally profitable. So with that new system, he was able, and the other executives, to identify the accounts that they wanted to get rid of. And over the course of a very few years, they shed 8 million members.
8 million policyholders.
8 million people, men, women, and children, yes. Now, some of them were shed by intention. Some, I'm sure, probably walked because or left for whatever other reason, but they intentionally had this program to purge these accounts. 8 million fewer people were enrolled in Aetna's plans. Many of them undoubtedly joining the ranks of the uninsured because their employers have been purged.
So what happened to Aetna's stock?
Went up. And
so did Ron's compensation,
so
right?
Ron's compensation and his stock on Wall Street.
And so I think in the context of thinking about a government plan, what we say is, let's identify the problem we're trying to solve. Let's work collaboratively with physicians, hospitals, and other healthcare professionals, and make certain that we solve the problem as opposed to introduce a new competitor who has the rule-making ability that government would have.
They do say they are in favor of an individual mandate. They want us all to be insured.
For the government to require every one of us to have some policy.
Exactly, and that sounds great. It is an important thing that everyone be enrolled in some kind of a benefit plan. They don't want a public plan. They want all the uninsured to have to be enrolled in a private insurance plan. They see those 50 million people as potentially 50 million new customers. So they're in favor of that. They see this as a way to essentially lock them into the system and ensure their profitability in the future. The strategy is as it was in 1993 and 94 to conduct this charm offensive on the surface, but behind the scenes to use front groups and third-party advocates and ideological allies and those on Capitol Hill who are aligned with him philosophically to do the dirty work, to demean and scare people about a government-run plan. trying to make people not even remember that Medicare, their Medicare program, is a government-run plan that is operated a lot more efficiently. And also, the people who are enrolled in our Medicare plan like it better. The satisfaction ratings are higher in our Medicare program, a government-run program, than in private insurance. But they don't want you to remember that or to know that, and they want to scare you into thinking that through the anecdotes they tell you, that any government-run system, particularly those in Canada and UK and France, that the people are very unhappy, and that these people will have to wait in long lines to get care, or wait a long time to get care. I'd like to take them down to Wise County. I'd like the president to come down to Wise County and see some real lines of Americans standing in line to get their care.
Wendell Potter, thank you very much for being with me on the Journal.
Thank you for inviting me.